The Raftani Foundation established the Save a Life initiative, which we call SALI, as a very innovative way to provide, we started with health services in fragile and conflict-affected countries. The real focus was to move away from just providing short-term quick fix to be able to provide sustainable services to the community. And that provided some real challenges. Yeah, in many of the developing and fragile countries, at the moment, much of that work is delivered by international NGOs that come and do short, quick activities and then disappear. You know, and very little of the funding, the international funding, flows to local NGOs. And that's a real dilemma. The local NGOs are not being developed, they're not having capabilities built, they're not having funding given to them, and yet they're the ones that the people trust. And so the initiative we've developed was really said, how do we develop NGOs, local NGOs, to be able to deliver sustainable and high quality services to poor and impoverished communities? That was our challenge. We looked at a range of countries. We looked at Yemen, Palestine, Syria, and we chose Sudan as our pilot. It's a country that's coming out of conflict and it's in dire need of support. But it was also a country that had a couple of NGOs that we'd known for a long time and trusted. And we elected to start here and work with them. And so we chose Zed-Narain and Patient Helping Fund as our two starts. What SALI is doing is establishing a capability development program for those NGOs, but it's doing that through delivering at the moment 6 pilot projects. And this primary healthcare project in Khartoum is one of those. Now, SALI's providing the funding for the initial 3 years straight away. But the real essence of the model is not just to provide that short-term funding. It's to develop the skills in the NGOs so they can deliver high-quality services, but also start to establish capabilities where we can have, through entrepreneurial activities, generate funding to support these activities for 10, 20, 30 years. And we've started that. One of the projects we're looking at the moment is to develop a number of new hospitals. And these are specialist hospitals focused on real needs in different parts of Sudan. But the income we generate from those hospitals through patients that pay and from health insurance will generate enough funds for us to be able to run 2 programs like this for the next 20 years. So by developing programs like that, bringing in the funds and developing these in conjunction or with the local partners, we're creating services not only at the specialist level, but being able to deliver long-term sustainable services. With this program here, at the moment today, we have 3 trucks. One of them is delivering medical inspections and services. The other's laboratory and another's pharmacy. But there's no real records. When a patient, one of the locals comes, we don't know who it was. We don't track their health. We want to put in electronic systems in here where we know when a patient comes who they are, what the history of their medical is, right? What the results were from the last test. We need to be able to understand the community. What are the implications of the diseases, sicknesses, issues in this community? In other communities, this primary healthcare facility is looking at 31 villages. Is there a pattern across those there? Should we be providing different services, more services? Should we be structuring when we deliver the services at different times of the day, structuring people coming in different ways so we avoid queues? We want to treat these people as our customers and provide genuine services to them. And we need to provide the technology for that. That's what this program's about, developing locally NGOs, providing sustainable financial structures and giving them the resources to be able to deliver quality and effective healthcare to the community.